Warm greetings to one and all. Let's wait for a couple of minutes while we admit the rest of them. Hope you all can hear my voice clearly. So once again, this is Dr. Anita Sarjan, your MC for the session. If you wish to claim your certificate for the same, kindly visit our website, which is www.onlinedentistry.in/9 p.m. and register for the same. Online dentistry has been the pioneers in providing dental education via both online and offline platforms. The motto we preach is to redefine dental education. It has been established over 14 years that online dentistry have been conducting sessions for clinical practitioners across the globe. Established in the year 2008, so far we have covered over 203 offline courses and have conducted 1,022 online courses with an enormous amount of more than 30,000 followers on our platform. Let me proudly introduce the CEO of online dentistry, Dr. Binuti Abraham, who is one of the finest practitioners in town, an orthodontist by profession, a passionate photographer, and he owns his private practice at Kerala Dental Clinic, Aluva. Moving on to the academic head of online dentistry, Professor Dr. Joby Peter, currently the HOD of Department of Pediatric Dentistry at Anu Dental College and Hospital. He preaches the philosophy to catch them young and watch them grow. Over the years, we have grown dynamically, launching 10 centers in different parts of India. The latest addition to our courses, the one-year comprehensive and advanced master training program on interceptive and myofunctional orthodontics, have been successfully initiated with 2 batches. This is a multidisciplinary approach with intense training and hands-on session. Our program is now a fellowship program on interceptive and myofunctional orthodontics, which is accredited by the Manipal University College, Malaysia. It's a sister concern of Mahi University. Herein, 2 of the modules will be happening in Malaysia, along with the graduation ceremony and a certificate distribution as well. We are open for the registration for the next batch, which commences on September 22nd, 23rd, and 24th via our website. Another feather to our cap, our 3-day program is about to commence on the 28th, 29th, and 30th of April at Cochin, which will be an amazing workshop on interceptive and myofunctional orthodontics. We are thanking you all for your overwhelming response. We are happy to announce that we are batch full and open for the registrations for the next batch. You all can feel free to reach to us on our WhatsApp number or visit our website, which is www.onlinedentistry.in, or else you can mail us on onlinedentistry.in@gmail.com. Online dentistry have been conducting sessions all over India for the past 14 years. During the lockdown, we started conducting online sessions to benefit the practitioners, which have been received with great appreciation from the dental fraternity. In the year 2023, we are relaunching the same by providing free advanced learning CDs under the title Online Dentistry at 9 p.m. Without further ado, let me move on to introducing the speaker for the day, Dr. George Jacob. He completed his BDS from KVG Dental College, Karnataka. He secured his master's from Government Dental College, Trivandrum, and completed his senior internship at Government Dental College, Kottayam. He attended the Train to Trainer Master Clinical CDs program at Geneva, Switzerland, and also completed the FGDP program at UK. With 17 years of clinical experience and academic experience exclusively in the field of conservative dentistry and endodontics, he was a former professor at PSM Dental College and Research Center, and also the managing director and chief faculty at All Four Roots Academy, Endodontic and Aesthetic Dentistry, Cochin. He is the chief faculty at CPD programs for Oman Dental Society at Muscat. He is also the faculty at online certificate web series One World, One Endo by the Pro Dental CPD London and at CME programs at Dubai. He's also the coordinator for Thumbai Dental Hospital, Ajman. According to research experience at Sri Chitra Trinal Institute of Medical Science and Technology, Trivandrum. He's also the invited faculty at PG Department at Cook Institute of Dental Science and KVG Dental College and Research Center, Karnataka. He have trained more than 2,500 dentists over 17 years and have conducted 2,400 hands-on sessions workshop based on endodontics. He was also the former Joint Secretary at Conservative Dentistry and Endodontic Society of Kerala. Sir, we proudly welcome you to Online Dentistry, and the session is all yours.
Thank you, Anita. Thank you for this wonderful opportunity. I should thank Dr. Binu, Dr. Joby, and special thanks to Dr. Joe and Dr. Anita for coordinating it in a very smooth way. And today, like, I should say that I'm very proud to be here in this platform. It is something which Dr. Binu and Dr. Joby was nurturing for the past so many years. And now this particular platform has grown to such a big magnitude all over the world with a lot of followers. And we are so happy that many of our dentists, they are getting the opportunity to better our practice, better our knowledge, and thereby we have a better service to be given to our patients. So first, let me share my screen. Today's presentation is going to be very, very crisp and yes. Are you able to see my screen? All good?
Yes, sir.
Yes, thank you. Thank you. So, laminates is something which many of the general practice, dentists in general practice, many of them have still not started practicing. So whenever I take a survey among dentists, we come to know that there are many dentists still who haven't started doing laminates. So when Dr. Binu asked me to choose a subject, then I wanted a subject which is quite different, which is quite less explained by many of the faculties. So today I'm going to give you a very crisp presentation in which, like, you just have to sit back, relax, and just hear me. I want you to know, like, if you are not doing the practice of porcelain laminate veneers in your day-to-day dentistry, I just want you to know that you are losing out many of the luxuries of your life as well as for you, even for your patients. So I am going to explain to you, I'm just going to give you 10 reasons why you should be doing porcelain laminate veneers in your practice. So I'm sure that those who are hearing this lecture today, many of you might have already started doing porcelain laminate veneers. Many of you might have already have completed lots and lots of cases in porcelain laminate veneers. But still, I would give you some of the tips which would, in fact, give you more vigor when you enter your clinic tomorrow. So that when a patient comes and sits in front of you, and that particular case is indicated for porcelain laminate veneers, you can proudly and you can surely say, yes, I'm going to do it. So just sit back and relax and hear me. I'm just going to explain why we all should be doing more of porcelain laminate veneers in our practice. And as a part of the key discussions of this, like, I will explain why majority of the dentists fear laminates, because I have been asking many of the doctors whom I come across the reasons or their apprehensions, what pull them back from doing this mode of therapy. And many of the dentists who do not do porcelain laminate veneers, I came to know that they fear failures in porcelain laminate veneers. So let us also see like what are the various reasons why which porcelain laminate veneers fail. So, and the indications and how does it save the pulp? How does it prevent a root canal? So the concept has changed. Today, we don't require too much of root canals in our practice. So in such kind of practice, what we need is certain conservative therapies like porcelain laminate veneers. And also, like, what is the importance of porcelain laminate veneer as an aesthetic restoration? Why we should be doing porcelain laminate veneers more in our practice? So, over a period of time, porcelain laminate veneers, the therapy has evolved as an art and science. So, I never call it as a pure science because porcelain laminate veneers has a particular artistic value for the work what you do in your patients, because you have n number of options when it comes to porcelain laminate veneers. So this is a good book for you to refer. It is a book by Dr. Galib Gurel, is one of the pioneers in porcelain laminate veneers. So if you are a beginner in porcelain laminate veneers, this is a book you should start with. So if you want a reading to be done in porcelain laminate veneers, try to procure this book, The Science and Art of Porcelain Laminate Veneers by Dr. Galib Gurel. So let me start with the topic because today we have very limited time, and within this time I have to in fact explain to you like why you all should be doing porcelain laminate veneers if you have not started. The reason number one is one of the most accepted treatment protocol for aesthetics is porcelain laminate veneers. Let you be a practitioner in India. Let you be a practitioner in the Middle East. Let you be a practitioner in US, UK, Canada, or any part of the world for that matter. The first priority in aesthetic dentistry mostly comes with composites, of course, and after composites comes porcelain laminate veneers. And patients come asking for porcelain laminate veneers. So they don't just come and tell the doctor what can be done on my teeth. They just come and ask you, doctor, do you practice porcelain laminate veneers? Do you do veneering in your clinic? I would like to get my teeth veneered. So that is what patients ask you. And also, there is a popular question what the patients ask you. That is, doctor, do you do Hollywood smile? So these are certain keywords when it comes to your day-to-day practice. So if you want to handle this, you should be a doctor knowing and practicing porcelain laminate veneers. Because I should say that since this is the most accepted treatment protocol among your patients, even more than composites, they may be knowing porcelain laminate veneers, especially if they are well read and updated about it. Since we have much of promotions in the social media, and even if you Google about aesthetic dentistry, the results what you get more would be on this particular topic. So that is the first and foremost reason for all of you to learn porcelain laminate veneers and practice it if you haven't come across till now. Number two, what is the reason number two? When you consider porcelain laminate veneers, what is the ideal thickness for a porcelain laminate veneer? Most of the time, for a porcelain laminate veneer, the thickness what is required is as less as 0.3 to 0.8 millimeter. I don't know whether you have come across this kind of thickness in your day-to-day practice. In your day-to-day practice, most of the time, you may be doing a crown. And when you do a crown, the thickness of your crown is most of the time 1.5 or even 2 millimeter. So imagine you are going to do a therapy with a thickness which is 1/4 of your routine dentistry. So that means that this particular therapy of porcelain laminate veneers cannot be mastered without a proper structured training program. So it is not as easy as you master your crown and bridge. So that is one important reason why majority of the dental general practitioners do not do this kind of modality in their day-to-day dental practice. So, and this is one reason, this preparation depth being so small is one more reason why you should learn porcelain laminate veneers. You know why? You are going to be as conservative as possible. So when you prepare a crown, what actually happens? You remove almost of the entire enamel gets completely removed from the tooth and a portion of the dentin. Whereas if you practice porcelain laminate veneers with caution, you hardly remove any of the dentin. Your preparation is mostly in your enamel. So this is one more reason why you should learn porcelain laminate veneers. So if you are a lover of conservative dentistry, or if you are a lover of minimally invasive dentistry, then I would advise you to shift from crowns to this kind of therapy for your elaborate aesthetic needs. Now, the third reason why I insist on porcelain laminate veneers is that they preserve the vitality of the tooth. How do laminates preserve the vitality of the tooth? So usually, let us see with some diagrams like how when you do a laminate, how can we preserve the vitality of a tooth? So we know that the most important organ in a tooth is nothing but your pulp, because the pulp gives life to your teeth. Unfortunately, if a tooth is infected, the last resort of retaining the tooth is nothing but root canal therapy. But root canal therapy should not be a part of your fashion dentistry. Root canal therapy has its own indications. So the trend of doing intentional root canals is slowly coming down, because now we believe strongly in biomimetic dentistry, in which we try to preserve the vitality of the pulp as much as possible. So keeping this in mind, if you are going for a cosmetic correction of your tooth, of your patient, okay, the best possible cosmetic correction for a labial surface relocation is nothing but your orthodontics, because when you do an orthodontic therapy, the tooth is moved in such a way that the patient's smile is much more appealing. And today we have better therapies, better modes of treatment in orthodontics for your tooth movements. Gone are the era when all your cases were treated with bonding and bracketing. It's all gone. Now you have your digital dentistry in your fingertips, in which you use fine scanning, 3D printing, and you have your aligners for your rescue. So patients also have accepted the different types of aligners. So this kind of aesthetic dentistry becomes much more easier. And the main advantage is that you are not sacrificing any of the patient's tooth structure. But unfortunately, if the time span, what is allotted for the treatment is much less. For example, if the patient wants a cosmetic therapy immediately, probably in 1 or 2 weeks, then you cannot depend on orthodontics. Sometimes you may have to go for certain treatment like crowns or laminates. So in this particular treatment, what you do is nothing but you are just relocating the labial surface. So when you relocate the labial surface, if you are going more near to the pulp in the labial. And when you go near to the pulp, if you are managing this labial surface relocation with a crown, many times you are sure to expose the pulp. And we all know what is the price you have to pay if you expose the pulp in the middle of your cosmetic dentistry. So many times we are forced to go for intentional root canals when you place crowns, when you have a cosmetic correction along with that. But if you are practicing a laminate, I already told that the laminate, it is 1/4 of the thickness of your crown. So that means you have a more conservative buccal surface relocation. And when you have a more conservative buccal surface relocation, the advantage is like your pulp can be saved. You don't have to go for an intentional root canal therapy. So your patient's tooth remains vital probably throughout his life. That is what we see in our day-to-day practice of dentistry. After doing 22 years of porcelain laminate veneers in my practice. So, one more reason I would stress upon is a major misconception what all of us have. Even I also had this in the beginning of my practice. I always thought that when you place a crown over a tooth, the tooth gets stronger and stronger. No. Do crowns in reality strengthen the teeth? Actually, no. It is a misconception, and various studies have proved that. Like when you place a crown, many times you are not strengthening it. You are creating weak points, and especially if the tooth is root canal treated. So, the latest studies have revealed that laminates are much better in terms of strength once it is bonded. So if you have a concept that crowns strengthen teeth, then I think it is high time to rethink and start learning laminates and start practicing laminates. The reason why I tell you is this, because when you do a crown preparation and at the same time you need to meet your cosmetic needs, see what is happening. A major amount of tooth structure is being taken away by the preparation what you do. So what is left? The picture on your right side, you can see a crown being done. And with that crown, you can see the amount of dentine what is remaining. Enamel, hardly anything is there. But on your left side, you have your laminate being done. And in this, the margins are all placed in enamel and much of the dentine is preserved. Even the vitality of the pulp is also preserved. So this is one of an excellent method to make sure that your tooth remains in its natural strength. So this is one more reason why you should be learning porcelain laminate veneers. And if you ask me, there are a lot of other advantages why you should be learning laminates. If you are a strong believer of biomimetic dentistry, then I would say that the material what we use for your laminate, that is your lithium disilicate, that material is called lithium disilicate. The particular ceramic what we use to fabricate a laminate is known by, the commercial name is Emax by Ivoclar Prosthetic System. And the material is nothing but lithium disilicate. It is a glass ceramic. And the properties of this glass ceramic, when it is bonded to the tooth, okay, it is somewhat, not the same, but somewhat similar to enamel. The optical properties plus the appearance and the texture and the way you can manipulate the material to get the luster of enamel. It is so biomimetic. Like I would say that if you compare with composites, like lithium disilicate would be having an upper hand when it comes to substitution of enamel. That is one more reason why I love laminates. Then, if you are a person who would not like to irritate your neighbor, that is nothing but your periodontium, then I think you should seriously think about laminates. The one advantage with a laminate is that laminates many times do not encircle the tooth 360 degrees, whereas your crown does. So when you have less gingival margins, you have less plaque retention, and your periodontium is much more healthier. So this is one way in which you can preserve the neighboring tooth structures, the neighboring periodontium, which is very important. So if you are a periodontist, if you practice periodontics in your day-to-day dentistry, then you would know like what is the importance of periodontal health around your restorations. So many times, if your preparation is much less, it is very minimal. The preparation may be even limited only to the buccal surface. And if your preparation is limited only to the buccal surface, hardly very minimal contact exists between your restoration and your gingiva. The reason number 7 why I like it is basically because this is one of the most highly aesthetic work what you can do for your patients. Patients don't even realize like which is the real tooth, which is the fake tooth. They don't actually have a feeling. Even when they run their tongue, your artificial tooth, they are much more comfortable with that than the natural tooth. Many times this doesn't happen with a crown because the crown encircles the entire tooth. And if your lab technician is good, if you have a lab technician who is passionate about dentistry, who is passionate about aesthetic dentistry, and I would say that he is a person who would love it. So these are highly aesthetic and a good lab technician loves it. Laminates have other advantages like they are more predictive. Because if you see the various statistics or if you see the cases, what goes from your own practice, laminates remain more predictive because they stay longer, they stay bonded. But there is one condition. What is that condition? The technique, what you do for this particular therapy should be good. If you do laminates with a faulty technique, then I would say that the results will be too disappointing. So the first and foremost reason why you should do laminates after learning the real science is that laminates are highly technique sensitive. Even not only for the clinician, but also for the lab technician, laminates is a challenge. Only if you master the art of laminates, go for it. So you need to, in fact, attend a structured course for this particular therapy. And suppose if you do it in the proper way, I would say that laminates are much more predictive than any other mode of restorations, what you have. And suppose if your tooth turns non-vital due to some reason, for example, when you do a therapy, okay, an aesthetic therapy, the tooth was white, but due to some reason, a previous trauma or any other reason, the tooth turns non-vital or the tooth turns its color, then you still have an option of doing a root canal therapy without damaging your laminate. Suppose you are doing a crown, all of you would have experienced this. You need to drill a hole through the crown to get into the pulp chamber to perform your root canal therapy. Whereas in the case of a laminate, you don't have to do that. All you need to do is to go for a root canal therapy without damaging the ceramic. All you need to do is to create an access from the lingual side. So I've almost given approximately 9 reasons why you should be doing a laminate more than a crown. Okay, if I go on like this, I can give you n number of reasons why you should be doing a laminate. But I have promised you 10 reasons, and the 10th reason is that laminates have wide variety of indications in your dentistry. It can be used in various scenarios, clinical scenarios. If you want to increase the length of your tooth for your cosmetic purpose, if you want to do a smile designing, if the patient is having a defective tooth, like a fractured tooth, already having a composite restoration, which is not good, a tooth with a discoloration, which you tried bleaching, but doesn't happen, any defective previous restorations or any defective tooth, like a peg-shaped lateral, cervical aberrations, any corrections, full mouth rehabilitations. When you do full mouth rehabilitation, the anterior rehabilitation, we prefer to go for a laminate than crowns. There are many reasons for that. So if you ask me, there are n number of reasons why you should be going for a laminate more than any other treatment protocol. But I can show you some of the cases, what we do on a day-to-day basis. This is a case in which a very young lady, probably she is in her 20, probably 19 or 20. She approached me immediately after a trauma. So this is a kind of traumatic injury which all of us would face in our day-to-day practice. So she just became suddenly unconscious and fell, hit on some solid object, and lost 2 pieces of the anterior tooth. So when we examined the radiograph and when we examined the clinically, probably years back, in the initial days of my practice, I would have jumped and performed a root canal therapy, which I no longer do. I went for a pulp vitality testing, probably at a later point of time, not immediately after the trauma. So both the teeth were whiter. And radiographically, you may feel that the pulp is exposed, but actually not. Because we all believe radiographs are 2-dimensional picture of a 3-dimensional object. So when you see clinically, pulp is not exposed. So this is an ideal candidate in which we can perform a very conservative therapy. And the most conservative therapy for this particular condition would be a composite restoration. But this patient had a very special request to me. She told that both her central incisors have been proclaimed since long. So is there any chance that, when you do the composites, can you do a little bit retroclination for the teeth? So then I thought, with composites, it's difficult. Why don't we go for a laminate? So we went for 2 laminates. And this is the preparation of the laminates, what I did over there. It's a wrap-around design. It's called a wrap-around design in the mesial and a split design in the distal. And lingually, it is wrapped around. So this particular conservative design was used for this case. And these are the laminates. And it's been almost, this patient comes to me for a regular review, almost 8 to 9 years before I did this for this patient. And still it is intact. So this is the beauty of laminates. So something which you don't get with a composite, you get with laminates. Even when there is a pulp exposure, the tooth is traumatic, still you don't have to actually go for a perfect root canal. If the pulp exposure is very recent and the patient comes immediately within 1 or 2 days of the pulp exposure to your practice, you can perform something called as a pulpotomy. You have now a lot of choices when it comes to the bioceramics like MTA, biodentine. These can be used so that the remaining part of the pulp remains whiter, and a very easy laminate can be done for such cases. There are also other indications, like for your cosmetic purposes, closure of your diastemas. If the tooth is in the lingual version, you want to add, it's called additive cases. If the tooth is in the buccal version, you want to delete, it is called subtractive cases. So n number of reasons why you should be doing laminates in your practice. For example, this particular case of diastema, multiple diastema, the patient wants ideally it should be an orthognathic surgical case, but this patient doesn't have time or doesn't want to undergo an orthognathic surgery. So we had to, in fact, give her some kind of cosmetic enhancement just before her marriage. So we had to go for laminates, and these are the laminates what we fixed for her. So such kind of cosmetic corrections are easily managed, easily in the sense like if you follow the protocols, it's easy. Otherwise, it's going to be tough. So the training in this particular field is very, very important. Suppose if your patient comes with old composites like this, it is discolored. Sometimes it may be dislodged or discolored. They want to change it. And this patient also has a special request. One tooth is proclined, so she wants both her central incisors to be in the same level. So, and she doesn't want an orthodontics. She wants a shortcut procedure like a laminate. So this is how we go about it. Like 2 laminates, preserving one contact on one side, okay, and encircling the contact in the mesial. And this is the tooth what we gave her. And you can see the beauty. You can see the aesthetics what you provide with the laminate. And in this particular picture, only the 2 central incisors are laminates. If you see this, see, the lateral incisors are natural. So if you want to copy paste a natural lateral incisor to your central incisor, it is possible. And there lies the importance of lab communication, because your lab technician doesn't see this. Your lab technician doesn't see the patient. So the importance of a good photography in your practice comes there, and also the importance of the lab communication. You need to, in fact, be aware about what is happening in the lab and facilitate your technician accordingly. So that is also one important part of the training. So this is how the patient entered. So to be honest, like these are certain cases which comes in our day-to-day practice in bulk, in a lot. And I have been doing this in and out for the past 20 years. So this is not something which can be neglected. If you are not doing in your practice, I strongly believe that you should find one person as a mentor. You should learn it and then start doing it. Sometimes some of your patients come with congenital defects and discoloration. Like it may be widely spread over the teeth, anteriors as well as posteriors. Sometimes it may be a case of full mouth rehabilitation, FMR. But at least the anteriors, you can give, this patient is hardly 15-year-old girl. And she is, many times our patients are not really happy with the way they smile. They never smile. There are children who doesn't smile just because they know that their teeth are bad. So this affects their confidence, especially as a teenager. The age at which you have to perform, the age at which you have to mingle with everyone, the age at which you start your real social life. If you have a problem like this, then it's important that you go for a proper therapy for such patients. And this is how we prep the tooth. This is the model impression. Okay. This is the lingual side of the preps. So lowers, minimal prep. These are the impressions and models. These are the laminates from the lab. And these are the ones which we fixed. So this is kind of more of a service to such kind of people rather than a luxury. This therapy cannot be considered completely as a luxury treatment. It is more like a service to which boosts the confidence of such patients. And in this particular service, you are saving a lot of tooth structure. You are saving the vitality of the tooth. You are saving the pulp. So, and you can also see the features, what we place onto the tooth. And remember, these features, what we place on the tooth, they are permanent. It's not like a composite which wears off or which goes after some use or after some years. Ceramics, the features what you create, they last longer than your day-to-day composites. So it's worth it, worth exploring it. So tomorrow itself, I want all of you, if you are not into this, you should start. And the smile what you get from all these is priceless. And generally, why do we fear laminates? Two things. Number one is retention. Second one is strength. We fear that our crown comes out many times. Then what will be the state of laminates? Laminates should easily come out. No, it's not true. Because laminates are not cemented. Laminates are bonded. So if you have a bonded restoration, the retention and the strength is multifold. So the secret of this is nothing but etching the ceramic and silinating the ceramic. And that is the magic of a laminate. So you cannot simply use any cement and fix a laminate. You have certain protocols in which the most important, I believe, is etching the Emax ceramic, lithium disilicate, and silinating it before you bond it. And in the lab, you have the choice of lithium disilicate, which is a pressable glass ceramic. And that is the only ceramic which can be properly etched to get a sufficient bond strength. So do not try laminates with any other restorative material other than lithium disilicate. Because when you compare with zirconia has its own limitations. Zirconia, even though the compressive strength is high, the aesthetics is totally different with zirconia and lithium disilicate. So, like in an aesthetic zone, I would always prefer lithium disilicate over zirconia. So, the treatment what you give, they are much more beautiful. So, a good clinician and a good technician loves to do laminates, and it's a teamwork between these two. See this boy? He has a lot of multitude of problems. He has diastemas. He has discolored tooth, which is root canal treated. So we went for preps. Okay, 4 laminates. Canines are not touched. Okay, simple 4 laminates. Okay, it's been almost 5 years or 6 years since we did this therapy. Yeah. So this is the lingual side of the, and this is how the laminates go. So these are certain treatments which will fetch you a lot of patient appreciation. A lot of people would love to come to you for aesthetic dentistry. So that's it for today evening. This is the reasons why I always insist you to start with laminates. And a big thanks from my side to all the participants who have been lending their patient ear for the past few minutes. Like I'm sure that like whatever I told here would throw a light on your practice. If you are already doing laminates, make sure that you learn more and more and become better in that. If you haven't started laminates, it's high time. This is the time you should start. You can reach me in this phone number. You can WhatsApp me if you require any kind of advice regarding starting this treatment protocols, or if you are already doing laminates, and if you're having doubts with your free to discuss it, provided not over the phone, but I can always do it over WhatsApp. 944-722-1596 is my number. And you can follow me in Insta. We have 2 Insta pages. Our academic Insta page is all4roots_academy. And my personal Insta page is all4roots. And so you can see our activities in our Insta pages. So thank you once again. And this is one program which is coming up in Dubai on 12th, 13th, and 14th of May. Like it is a complete program on anterior and posterior restorations. We will be speaking about composites. We'll be speaking about laminates. We'll be speaking about indirect restorations like inlays, onlays. We would be always, and also we'll be giving an insight about posterior composites. So it's a complete package for 3 days with hands-on. If anyone in the Middle East, you are interested to join, please do contact me or in the number what is given in this brochure. So thank you one and all for your patient listening. Thank you, Anita. Over to you.
Thank you, sir. It was indeed a very wonderful session. So we have our chat box is flooding with questions, sir. So shall I shoot?
Yes.
So it's from Dr. Nikhil Justin. Till how much tooth shades can be improved with laminate veneer, and how many years can a veneer last?
Okay. So the possibility of changing the color or the shade of a tooth is much higher with a laminate. You want to make a A4 shade tooth look like A1 or even bleach shade, you can do that. Because now we have a lot of laboratory techniques. All you need to do is to choose the correct ingot. Ask your technician to choose the correct ingot. And you also has to choose the correct resin cement. Even the resin cement, what you bond your laminates, it has certain shades. So those shades can be manipulated or altered to get this result. And durability of laminates, in my practice, I've been doing this from my post-graduation onwards. And in my personal practice, private practice, I started probably 15 or 16 years back. 16 years, I have a track record. And many. From 16 years, I can give you a big list of patients. And among all the patients done till now, I just had 2 units debonded. 2 units, not 2 cases, 2 units. Probably I may be doing canine to canine. Out of that canine to canine, 1 unit comes out. And that too only from 2 patients. Provided the patient comes back to me, but I always believe that the patients come back to me because I have the case record and we have a good review system in our practice.
So the next question is from Dr. Vaibhav Patni. Have got a patient with missing central incisor. He's planning to give a bridge, so can laminates be used for the same?
Dr. Vaibhav, I hope you have picked up my WhatsApp number, which was there in the previous slide. Just put a personal message in this number. I'll send you 1 or 2 cases of mine and some cases of my students in which we have done a heroic laminate supported bridges. So you'll be more convinced.
Yes, sir. Thank you, sir. So the next question is from Dr. Mejo Matthew. What are the scenarios in which you would recommend crown instead of laminate?
Not exactly. Only if the tooth is root canal treated and you have a post on it, the enamel is not good to bond. You have that much loss of enamel. And it happens very rarely. It happens, but it happens very rarely. Badly broken down tooth with less enamel is the only reason. Otherwise, if there is a healthy enamel, all cheers to laminate.
Okay, so the next question is from Dr. Peromita. Can laminates be done in case of bruxism?
Laminates can be done in case of bruxism, but first you have to learn the principles of full mouth rehabilitation. You need to, in fact, find the real cause of bruxism. You need to, in fact, troubleshoot the real cause of bruxism of the patient. You need to sometimes increase their vertical dimension. You may have to go for a deprogrammer. You may have to rehabilitate the posteriors and the anteriors together. That particular art is called full mouth rehabilitation. then laminates are safe.
So the last question for the night, sir, from Dr. Nikhil Justin. So, sir, which resin cement would you recommend for the same?
We have different companies providing you resin cement. One, if you want to know the examples, Ivoclar is giving you a resin cement called Variolink. 3M comes with a resin cement called Reliax Veneer cement. Both are good. And many a times, it's not the aircraft, the pilot matters a lot. That means the person who is doing the therapy, the clinician, the skill of the clinician is what actually matters more than the materials what you use.
Thank you, sir. Dr. Vaibhav have messaged back that it would be of great help, sir. So, sir, we've come to the end of the session. So,
do you want me to take 1 or 2 questions? I don't mind.
Sir, if you have the time, sir, I shall read out, sir. Sir, from Dr. Rahul Kutti. Sir, can it be used to seal the lingual access cavity for anterior endodontically treated teeth? As I could see your photos, the lingual coverage is hardly reaching the cingulum.
Not necessarily. Suppose if you have a root canal treated tooth, okay, if you can seal the access of your root canal treated tooth with a bonded restoration, like a composite, there is no hard and fast rule that you should extend the margins over that. So you can keep your access closure separate and laminate separate.
Thank you, sir. So another last question from Dr. Nikhil Justin. Which type of veneer preparation is recommended? Window preparation or incisor overlapping preparation, sir?
Nikhil, the basic funda behind these preparation designs, like you have this window preparation, you have the incisal split design, the incisal bevel design, incisal overlap design. There are certain criteria for this. Depends upon the particular case. In some cases in which you don't have to lengthen the tooth, you can go for a simple incisal split design or a window preparation. But when you need a lengthening of the tooth or shortening of the tooth, you may have to go for a wraparound design, that is overlapping preparation. Proximally, when you have a diastema, you may have to go for an overlapping design. Proximally, when you have a caries, proximally, when you have a restoration, you may have to overlap it. So depending upon each and every case, this changes. And once you start doing it, probably like I'm telling you from my 20 years of experience, like this indication just comes to your brain simply says when your burr reaches there, okay, doc, go ahead, overlap it.
So that's a great information, sir. So once again, thank you, sir, for being with Online Dentistry. So here we come to the end of our session. Stay tuned till the next 4th Wednesday for another punching session with another faculty. Thank you, sir. Thank you all. Good night. Bye,
thank
sir.
you all. Do keep in touch. Do let me know like how was the session. I want to know your feedbacks. Do WhatsApp me in this number. Thank you.
Thank you, sir. Have a great day.